Have you experienced unpleasant sensations in your eyes? How can you distinguish the effects of ordinary fatigue from dangerous symptoms of disease? Which diseases can lead to blindness? And why are they not always easy to detect? You will find answers to these questions in our video. Why do eyes get sick? This small but indispensable organ in our body is exposed to many dangers. In addition to traumatic injuries, the eyes can suffer from numerous bacterial, viral, and fungal infections. There are also many diseases accompanied by eye inflammation, as well as conditions caused by impaired blood vessel function in the eyes. Infectious eye diseases, eye infections are dangerous due to their rapid progression. If treatment is not started in time, severe inflammation may develop, leading to blindness. Among the most common infectious eye inflammations are neuritis, dacryocystitis, stye, dacryoadenitis, and conjunctivitis. All of them share common signs such as redness and swelling of the eyelid, increased tearing, and possible discharge of whitish pus. Pain may be felt in the eye area when pressed, and sometimes even without pressure. In the acute stage of neuritis and stye, systemic symptoms may also occur, such as fever and general malaise, similar to a common cold. Signs of retinal and corneal diseases. The retina suffers from four main diseases. First, pigmentary dystrophy. In this condition, images begin to double, the field of vision narrows, and visual acuity in low light is lost. The second retinal disease is retinal detachment. It is especially dangerous as it can lead to blindness in a short period of time. The disease can only be treated surgically. Even at an early stage, the patient may see bright flashes, haze before the eyes, and distorted shapes of objects. Similar symptoms are observed in retinal angiopathy. This process is associated with the degeneration of blood vessels in the eyes. Without treatment, this disease also ends in blindness. The final retinal disorder is retinal tissue degeneration. The outcome is the same: complete loss of vision. It begins with blurred images, floating spots before the eyes, and other common symptoms. The cornea most often suffers from damage to the eye's blood vessels. This occurs due to increased intraocular pressure. As a result, the shape of the cornea changes and a condition called keratoconus develops. Its symptoms include nearsightedness and the appearance of halos around images. If increased sensitivity to light is combined with redness of the mucous membrane, this indicates keratitis, an infectious disease of the cornea. Cataract and glaucoma. These two diseases are very widespread. They most often affect elderly people, but in recent decades, both conditions have been occurring at a younger age. Cataract results from clouding of the lens. Over time, this natural eye lens gradually stops transmitting light. In advanced cases, the disease leads to blindness. In such situations, treatment is possible only through surgery to replace the lens. However, the disease can and should be controlled by slowing its progression. For this, it is important to pay attention to early symptoms of cataracts. First, there is a decrease in visual acuity. If you have to strain your eyes to see small details both near and far, this may indicate the development of cataracts. Second, the appearance of dark spots before the eyes. This is the most typical sign of the disease. The third symptom is blurred vision, as if a veil were in front of the eyes. Finally, difficulty distinguishing similar shades of colors. Glaucoma is currently the leading cause of blindness. This disease develops due to increased intraocular pressure. It damages the optic nerve and can lead to hemorrhages in the whites of the eyes. The main signs of glaucoma include haze before the eyes, a cutting sensation as if something has entered the eye, tension, heaviness, and fatigue in the eyes even without significant visual strain. Another typical symptom is headache in the eyebrow area above the affected eye, signs of eye cancer. Unfortunately, oncological diseases of the eyes also occur. Tumors most often develop in the conjunctiva and in the tear-producing system of the eye. Such tumors manifest as pain in the eyes and head. This happens because, as they grow, they press on nerve endings in the eye area. Over time, movement of the eyeball becomes difficult and vision deteriorates significantly. Risk factors. For many eye diseases, including cataracts and glaucoma, risk factors include diabetes, high blood pressure, impaired blood circulation in the blood vessels, as well as injuries and hormonal disorders. Long-term use of hormonal medications can also have a negative effect. What vision problems have you experienced? Which symptoms indicated them?